About the discovery of small roundworms in the spinal fluid of every MS subject that was tested in this research. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. This research is truly groundbreaking because Dr. Alan MacDonald is the first pathologist, is the first researcher, is the first any type of doctor that has been able to identify and find different types of parasites living in the central nervous system of MS patients at the time of their death. I did do a presentation about where he found small tapeworm larval cysts in the central nervous system of every MS subject. And I did that on a different video. Make sure to go back and watch that if you haven't seen it. But today we're going to talk about these small filarial roundworms and how he found them, what they look like. You're going to see different pictures of them. And also, how do we treat them? How do we recover from them? If you have not learned about the research about the filarial worms found in MS patients or subjects, I did a series probably 2 or 3 years ago. Today is going to be an overview because this is such important research. And I really hope that as you see this, you're going to share it with others. But if you want to dig deeper, I did a 3 or 4 part series on filarial worms. You'll find that on YouTube and on Facebook. And so you can go deeper into this topic if you want. But today you're going to get a really great overview of the significance of this topic. It's so incredibly important. So it's not just that Dr. Alan MacDonald found many small roundworms especially in the spinal fluid, like easy to find. But also, I had a student a few years ago from Europe, and she was a pre-med student, so she was in medical school, and she looked at her blood and the blood of another friend who had multiple sclerosis, and she said it was really easy to find these filarial worms. So this is a special kind of worm, and we're going to call it filarial worms. So she said it was really easy to find, and she sent me pictures, and she wanted to publish a paper. So I actually saw what was in her blood. And then also, there are many studies for well over 100 years that have shown that when these particular small roundworms are in the central nervous system of domestic animals, those would be goats, sheep, horses, dogs, etc., those animals suffer with symptoms that are identical to multiple sclerosis. Identical. And I'm talking about things like fatigue and spasticity and slurred speech and tremors and drop foot, paralysis, poor balance. Like, it's insane. And those doctors, researchers at that time, when they were studying the infection of this roundworm in the central nervous system of animals, they were like, gee, I wonder if this could possibly be relevant for humans. But nobody since that time has ever studied this further, except for Dr. Alan MacDonald. So thank God for him. And then fourth, so there's 4 reasons why this is so significant, is that I have coached hundreds of wellness champions from all over the world. Most of them have multiple sclerosis or were diagnosed with multiple sclerosis. And the very parasite treatments that test well or would treat these roundworms, they really are testing well for these students, and they're really helping them to recover from MS symptoms. So we still have more research to go. We have more studying and perfecting the treatment. But if you have multiple sclerosis, this video will give you a lot of hope because it's not a mystery anymore. There is so much evidence that multiple sclerosis is an infectious disease caused by a parasitic infestation. The science is showing this. Lots of people are recovering from treating parasites, and that's all we need, right? Is that if the science says it and we're recovering, then we'll wait, and hopefully we won't wait, but hopefully our healthcare system will catch up to this. Let's talk about filarial worms for just a moment. So we talked about, or I have told you about these very large roundworms that can be 2 to 3 feet long. I shared a bunch of pictures. So our students do have a lot of very large roundworms in their intestines. And they also have probably tapeworms. We haven't seen a lot of pictures of tapeworms. It's not necessarily easy because we're doing these oxidizing enemas, and then by the time we're passing them 24 hours later, they're partially digested. So we're not sure if they're roundworms or tapeworms, but tapeworms are quite flat. They're ribbon shaped, where most of the worms that our students are passing that have multiple sclerosis and other diseases, they are round. They would look more like a noodle, or even they could be as thick as a pencil. So filarial worms are roundworms, but they're a lot smaller. They are smaller. They're not 3 feet or 2 feet long, but there could be at least 8 different types of filarial worms that can cause disease in humans. And then, this is really important, there are some types of these filarial worms that we know infect animals, and even the veterinarians know that a lot of these worms can be passed from animals to humans. Really important to think about that. Filarial worms, the adult, they can grow up to between 2 to 10 centimeters long. So they can get to be definitely visual with the naked eye. They're thread-like, they're quite thin, and the female worms are larger than the male worms, and the females give birth to larvae, which are living immature tapeworm, sorry, not tapeworm, I've got tapeworm. They're immature filarial worms, and we call them microfilaria. So if you hear the word microfilaria or microfilariae, which is plural, that is the baby form of the filarial worm. And just like we talked about with tapeworms, how very often, the tapeworms in our intestine, they cause stomach pain and they can cause us to become deficient in vitamin B12. So they definitely can cause a lot of problems. But it's their larvae, it's the babies that get into the central nervous system of the tapeworm, and they cause the neurocysticercosis, those tapeworm larval cysts. So just as the immature form in tapeworm are quite a big problem, the same thing is true for these filarial immature larvae, which we call microfilariae. We know that this type of worm and the larva, they're passed through biting insects. So it's not just a tick. It could be different types of black flies, and it could also be mosquitoes. So any kind of biting insect can transmit these types of worms, and the larva form especially. And there are different types of worms, and it's always the same, like different species or types of these filarial worms, they like to live in different parts of the body. So for example, some of them will infect our eyes. Some of them will infect our lymphatic system, our lymph nodes. Others, and so they could cause the elephantitis. Maybe you've seen where it's usually more in like Africa, where people have huge swelling, like a lot of swelling. And what's interesting, and I want to share this before I forget, is that a lot of times when these worms live inside of us, they have their ways of causing our immune system to be blind to them. So whether they're releasing something, I'm not sure what they're doing, but they cause our immune system not to really attack them. So we don't have as much inflammation when they're living. We can have some symptoms, but it's not like our immune system is just going full force after them. But when these filarial worms die, then they're no longer hiding from the immune system or protecting themselves from the immune system. And then the immune system goes after them very aggressively, and then we get a lot of inflammation, and they get blockages in the lymphatic system, and then they get all this swelling. So I've shared in my masterclass training that there's at least 17 different ways that various parasites can cause inflammation and immune dysfunction in our body. So I found that really interesting. So again, depending on the type of ferial worm, where it lives, so it can cause things like rashes and arthritis and hyper or hypopigmentation of the skin, abdominal pain, fatigue, other pain. And in animals, when these filarial worms enter their central nervous system, they will have, again, symptoms identical to multiple sclerosis. So, this is where these animals, and this is what veterinarians have known for 100 years, they'll have extreme fatigue, tingling, numbness, balance issues, spasticity, drop foot, weakness, paralysis, and much more. And there's one species of one type of filarial worm that was talked about, and that is Ceteria digitata, and that is a filarial worm that causes fatal cerebrospinal nematodiasis. So cerebrospinal means that these worms live in the spinal fluid and the brain. And nematodiasis, iasis is like inflammation, and nematode is worm. So it's worm inflammation, it's the disease. And this specific one will cause these problems in goats, sheep, and horses, and probably other domestic animals. And Dr. Alan MacDonald's work, like his discoveries, and this is why I'm sharing this information again, it is so vitally important to share his work with every practitioner that you can is willing to look at it. So he has a great short video lecture where he shows, I'm going to share some of his pictures on this video here. So in a few minutes, you'll see what he is showing. And then he also has a poster where he goes into detail about, and he's so generous. Like, he's like, this is how I did the study. Somebody else duplicate it, please duplicate it. But the sad reality is that, in the MS world, the experts, they really believe there's no value in examining spinal fluid or brain for different types of parasites. They're like, no, there's no value in it. And it's like, how can you say that when we don't know what causes MS and there is no cure? How can you say that, right? And anyhow, we won't go down that bunny trail, but it's just awful. All right, so Dr. Alan MacDonald stated, we have not found a single case of MS that does not have worms in the spinal fluid, in the cerebrospinal fluid. Again, we have not found a case, not even one case of MS where the subject did not have worms in the CSF, the cerebrospinal fluid. That is really, really significant. Dr. Alan MacDonald found, he found the filarial worms, and I'll show you the pictures, but he found like eggs, and he found the immature larva form, he found the adult form. So they're like living in our central nervous system, and they're replicating, and he found all kinds of like chalky material, like your spinal fluid should be clear. And it was like there's debris and their feces and possibly eggs of the worms all in the spinal fluid. So this was in 2016, he reported this, and he said that previously researchers, when they were working with animals, they spent a lot of time trying to find these worms in the brain. And he said it was quite difficult to find the worms in the brain because worms, they cause damage and then they take off, right? And so then you're doing all these slices of brain tissue looking for the worms, and they've caused their damage and they've moved. But he said, when you look at the spinal fluid, there are many, many roundworms in the spinal fluid. He said, they're so abundant, he said, it's like shooting fish in a barrel. So, I mean, if he can find that many worms, why is no one else disputing his research? Prove him wrong, like seriously, or validate him. But why is nobody touching this? Because there's no money in this. But this is where our answer is. So he said that these worms, they move around in the central nervous system and they create a storm of injury in their wake, kind of like the tail of a comet. And the microfilariae, they have the diameter, so the immature larval form, they have a diameter similar to the diameter of a red blood cell. And he said that it's really unfortunate. Dr. Alan MacDonald said it's very unfortunate, but today, most labs at any hospital or any medical school in the world, they do not routinely look at do smears of either the spinal fluid or the blood. They do not perform microscopic examination. They're not looking for infections. And this is routine. So this is not routine in any lab, in any hospital or any med school in the world. We have a problem. We're not going to find these parasites if we're not looking for them. So he did this first work. So yes, great veterinarians, they were finding these worms in the brain. It took a lot of work, but he's the first that looked in the spinal fluid and found many of these small filarial worms, and he was rewarded for his curiosity. And I think a reward would be much more than what he got. Is yes, it's great to get recognition, but he should be getting an award for that. I think it's huge. And he felt that there was probably more than one type of these nematodes present in the central nervous system or the spinal fluid of these MS subjects. So these people, they were confirmed cases of multiple sclerosis. So he got specimens from research brain banks. So people that died, they had a clinical history of multiple sclerosis. Their central nervous system, the spinal fluid and brain was preserved for research purposes. They granted Dr. Alan MacDonald permission to examine this, and this is what he found. And I was speaking with a colleague in Canada on the West Coast, and he is really involved in parasites, et cetera. And he does energy testing. And he said there are so many different types of species, types of filarial worms that he's picking up in his patients. And those patients don't all have MS. So this is not just an MS thing. So if you don't have MS and you're just listening because of parasites, these small filarial worms, they get into all of our body. It's just the amount of them that's present. If it's a small amount, our immune system will deal with it. We might have minor symptoms, but with any parasite, it really has to do with how many or how populated they become in our body. And when they become very populated, then our immune system is no longer able to keep them in check, and then we end up getting a disease label. And so he said, multiple sclerosis has a migratory pattern, right? We get a flare in one part of and this is part of the diagnosis of multiple sclerosis, right? They're looking for changes in MRI where there's different lesions in different parts of the brain and over time. And so MS is migratory in pattern, and one area will flare up, then it'll calm down, and then another area will flare up and it will calm down. And so the history of worm parasites in spinal fluids of domestic animals goes way back to 1880. 1880, that's a long time, where researchers observed brain injuries and they observed myelin and nerve tissue being destroyed. And that's exactly what happens in multiple sclerosis. But again, these doctors were really focusing more on the brain, and they didn't look at the spinal fluid for these worms. And so Dr. Alan MacDonald found them very abundantly. So Dr. Alan MacDonald mentioned it takes hundreds and hundreds of slides to find one worm in the brain. So what I'd like to finish off with here, actually, I'm going to go to my slides first, and then we'll talk about treatments. All right, so these are just a few images of what Dr. Alan MacDonald found when he was looking at 10 subjects, people that had multiple sclerosis, they died, and he was able to examine their spinal fluid and their brain. So this is just one image of I think it's a zygote. Actually, let me backtrack because I think there was one of an egg. So this is an image of an egg. So for the ferial worm, they have eggs. So this would be an egg. And then there is a zygote, which is a fertilized egg. And here we have the spinal fluid. So the spinal fluid should be clear, but it was very chalky, and it was like it had a lot of debris in it. And the debris, he feels, is some of the worms that die. There will be debris from that. There will be the waste material coming from the worms and possible eggs from the worms also. And then this is an image of a coiled ferial worm in the spinal fluid of an MS subject. Here's a cluster of ferial worms that he found. So it's a whole bunch of them hanging out together. And we'll talk a little bit about the green dye in a moment. Again, these are all taken by Dr. Alan MacDonald. He is a hero. He really deserves to win a prize for all of his discoveries of the living parasites in multiple sclerosis subjects at the time of their death. This is another image of the ferial worm close up. The top part of it is its head, and you'll see that it's a little thicker green there. That has to do with hooklets, like other worms, like hooklets that they have to attach themselves. And then this is another image of ferial worms and their mating. All right, so these are two ferial worms mating, and in the next image, he is actually the first researcher to discover 3 of them mating together in the spinal fluid. I mean, anywhere. I guess usually they would find 2 worms mating together, but he found 3 worms mating together, and this was in the spinal fluid of MS patients. And this is a really important image here. This shows 2 of these ferial worms, and you're probably wondering what the green is. The green is a fluorescent dye that is attracted to the genetic material of Borrelia, which is the spirochete bacteria that causes Lyme disease. And so these nematodes, these roundworms, these little roundworms that get into the central nervous system, they also carry Lyme disease into the central nervous system. Could they have other parasites inside of them? Absolutely. Dr. Alan MacDonald only tested for Borrelia because that's his expertise. He has a huge history of really studying Borrelia. And so he found that these little roundworms are infecting our central nervous system with Lyme disease, with Borrelia, the bacteria that causes Lyme disease. That is incredibly significant. He also did find Borrelia just in free form in the central nervous system of MS patients also, or MS subjects. But this is very, very significant. And so I have talked a lot about Borrelia, and there's over 100 years of research showing the connection between these a spirochete type bacteria and multiple sclerosis. Again, 100 years of research, and 100 years of research of a malaria babesia type protist in multiple sclerosis. And here we have where veterinarians have known for at least 100 years that when these roundworms are in animals, they have all the neurological symptoms of MS and other neurological diseases too. So please be aware, like we have students that have PLS, etc. So they have a lot of similar symptoms to MS, and those symptoms go away when they treat these worms also. So just so incredibly fascinating, just absolutely grateful for the work that he's doing. I'm just going to finish it off here really quickly with talking a little bit about treatment, because it's all fine and dandy to discover we have worms, but how the heck do we treat these worms? And I will be really honest in saying, if there was a magic pill cure, I honestly would write a book. We would cure the world, and, I would just be able to go do something different. But it's not that easy. So before we start treating, it's very important that we lay a really solid foundation. when we have chronic disease, like any kind of neurological disease or a serious autoimmune disease, we've had a parasitic infestation for a long time, and we have multiple parasites that are involved. So it's very important that we do a little bit of prep work before so that the treatments will work a lot better for us and we'll tolerate them better and we can recover more quickly. It still takes work, but the parasite drugs, the herbs, there's no one single magic cure. Our body is quite like there's a lot of area inside of our body or volume, and the parasites are very happy in there. They're very well established. They have been faking our immune system out for possibly many years, and so we have to disrupt that. So what we do is we first follow the Live Disease-Free diet, and that is a low-carb diet. It's very satisfying, it's very tasty, it's very fresh. You'll love it. Your taste buds will change. You'll get over the sugar cravings, etc. So we're going off of alcohol and caffeine. Caffeine will stimulate the parasites. We're getting rid of all the sugars. We're going quite low, down to 30 to 40 total grams of carbs per day. And I have all the guidelines online. They're free. You can just do a Google search of Live Disease-Free guidelines, and you'll find them there. There's a 3-minute video. There's a little cheat sheet you can put in your kitchen. And if you want more detail, I've got videos on YouTube and Facebook, Live Disease-Free, about our diet. So you can learn how to follow the diet. And you will have a lot of symptom improvements because the parasites will be less active, the inflammation will start to go down, and you'll start to feel a lot better. Then our students are really supporting their body by doing things to have daily bowel movements and sleeping well at night and making sure they don't have mold in the environment, decreasing the wireless radiation, looking at their blood work, supporting physiology, opening up all the detox pathways, just making sure that they're eliminating and getting rid of these toxins, which are mostly coming from the parasites. And then once they've gone through this prep phase, they're feeling a lot better already. At that point, they are going to start treating. And we find that we started off with herbs. We love herbs, but we have not found that they are effective enough on their own to recover from chronic disease. Things can change in the future, but we've been doing this for a very long time. And so we do use them, but we use them in conjunction with other things. So there is an oxidizing agent, which is like an oxygen type therapy. There's various different ones. You can learn more about that on Live Disease Free, or you can go on to Rumble, Live Disease Free, and I talk more about it. I'm not censored there, so I have to be careful what I say here. But it is basically bringing oxygen in, and we can do enemas, and we can take it orally, so we can treat some of those ferial worms that are found in the blood, and also big and small worms in the large intestine. And then our students are energy tested for which of the parasite drugs that are testing well for them. And going on to the treatment part, because this is where we're at right now, but I just want to reiterate that what I'm sharing with you is for educational purposes. I'm not recommending that you take any treatment because, if you're sick and you just go onto forums and you hear about this drug or that parasite drug and you get access to it and you take it and you're like, oh, it's not really working for me. I must not have that parasite. Or what if you're not taking enough? What if you're not taking the right treatment? What if you take a suboptimal a dose? What if you do have a certain parasite and you're not taking enough? And then the parasite becomes resistant to it. You can't use that treatment in the future. So you're better off to work with someone who knows what they're doing to make sure that you're using them safely, a practitioner that you're using them safely, effectively. That's really important. You can't do this on your own. You can go to the health food store, you can get some herbs, checking with the pharmacist to make sure nothing interacts with what your medications you're on, or maybe you have a medical apparatus, or maybe you've had an organ transplant. So never just take herbs just because they're natural medicines. But you could just do something from the health food store. But if you have chronic disease, you'll see that you still have the chronic disease. It's not enough. Trust me, we wouldn't have to do this work. We could cure ourselves if we could just go to the health food store and get some herbs like wormwood and black walnut and cloves. It's not that simple. You might pass some parasites, but you will still have your disease. You'll still have the symptoms you're dealing with. And it sucks, but that's just the way it is. So we find that a layering of therapies works a lot better. So we're using the oxidizing agent. We're using it through orally and enemas at a certain time when we're stronger and we're feeling better. We've gone through the prep phase. And then we're also using specific herbs that we test well for, and we're using certain parasite drugs. So there are certain parasite drugs that treat roundworms, and there are certain drugs that treat flatworms. So that could be tapeworms or flukes. There's certain drugs that will treat different types of protists, which are single-celled parasites. And there's certain treatments which we kind of like more of the herbs to treat bacteria that could be pathogenic or parasitic for sure. So when we're talking about these filarial worms, they're pretty difficult to treat, and the parasite drugs are not extremely curative, I would say. So there are some drugs that are more helpful. And I'm just going to share really quickly. Again, I did a more detailed study on this 2 or 3 years ago. You can find that again on YouTube and Facebook, where I go more into the studies. But basically, the drugs that are helpful to treat these filarial worms would include ivermectin and albendazole and DEC, which is dimethylcarbamazine, levomizole, fenbendazole, and moxidectin, and there's others. So those are just some of the parasite drugs that are helpful. So albendazole is really helpful for a lot of roundworms, but by itself, it doesn't seem to clear the filarial worm. Same thing with albendazole with, just putting, let's say, albendazole with ivermectin or albendazole with DEC. But there was one study that I looked at where they found a triple therapy was more helpful. So this is something you can talk to your doctor about, where they were using albendazole, ivermectin, and DEC, and versus not having as great results with albendazole and DEC. So albendazole, ivermectin, and DEC, which is the dimethylcarbamazine, I believe it was called, diethylcarbamazine, which is abbreviated capital D, capital E, capital C. So another thing to remember is that when your doctor is prescribing albendazole, then it's really important to have a lot of healthy fat with your meal. They recommend at least 40 grams of fat. That's about 3 to 4 tablespoons of fat, because albendazole is poorly absorbed. And if you don't have enough fat, it's only going to just work in the large intestine, small intestine, and it's not going to cross the, get into the blood-brain barrier, cross the blood-brain barrier, work more systemically, etc. So very important and I think it's just really good practice whenever you're treating parasites to make sure that you have lots of healthy fats with your meals, because it's not just true for albendazole. I've read for nitazoxanide, which is a linea also. So again, I did a 3 or 4 part series on filarial worms if you want to learn more about it. But it really is my hope that you help to get the word out. So on our website, livediseasefree.com, on the main page, the home page, we have a menu. And if you click on that, you'll see research. And if you click on that, it says evidence that multiple sclerosis is an infectious disease. And there you can go down to parasites, as far as worms, etc. And you can see Dr. Alan MacDonald's lecture. There's also posters of his work. I've also done I'm sure that I have done just like a 1-page blog on his lecture and his poster, and you can share that with a doctor or healthcare professional too. So our doctors, unfortunately, they have been trained for many, many years that parasites are only an issue in the underdeveloped countries, and we don't have to worry about parasites in the developed countries. And that is not true. Parasites are present in all countries. We may chlorinate our water, treat our water, usually, And that's true. And so then if we're not drinking raw water, that will definitely help. But these parasites are located on the fruits and vegetables we eat, the ones that are coming in from other countries, but also the ones we grow in our garden, right? We could have animals that deposit their waste. We can pick up these parasites by walking barefoot on dirt. Some of them can crawl in through our heels. We can get parasites by pushing a shopping cart and working gardening. We love to garden. And I'm saying pets, we might have pets. And yes, enjoy your pets, enjoy gardening, enjoy walking barefoot. Like try to make sure that if you have animals and they are, depositing their waste, make sure you have a special area and you keep it clean. You pick up their waste immediately so they're not stepping in it, but don't have it all over your yard. Do not let your pets sleep in your bed. Deworm them regularly, just like we would with ourselves, and just enjoy life. Just do the gardening, do all of those things. But the reason that so many of us are running into this problem with parasitic infestations is that there was a time in your life when you were on 1, 2, or 3 or more antibiotics. You might have been on antibiotics for a longer period of time, like I was, for treating acne. And at that time, we lost our natural defense. It was very, very compromised. And when our natural defense is compromised, we are susceptible to whatever parasites are in our environment. We didn't know that. And so then we become infected. And then it's our lifestyle, it's the environmental factors, it's the high stress, it's the high carb, it's the not getting enough sleep and not getting enough, being active enough. All of these different factors and more will allow the parasites to get a hold on our body quicker or more slowly. And that's how we end up with sickness. So we have to learn how to restore balance. We have to learn how to decrease the presence of these parasites in our body. We can't sterilize our body, but we can decrease their presence enough that we feel amazing, that we have tons of energy and we have strength and we can exercise and we have mental clarity, right? We can carry on a conversation and we can sound like we're intelligent and, just anti-aging, just looking younger, feeling younger. All of these things are true when we correct our microbiome. So it's not just about diet. It's not just about exercise. It's really about understanding that when we have a disease label like MS, we're not just dealing with filarial worms. We're probably dealing with larger roundworms, filarial worms, possibly flukes or tapeworms. And it's shocking. Like I was shocked when I saw what was coming out of me. I'm sure they're intestinal flukes. I probably had tapeworms. I don't know for sure, but probably had tapeworms, but for sure, very large roundworms and flukes. Absolutely. Filarial worms, I couldn't see them, but chances are if Dr. Alan MacDonald found that in 10 out of 10 MS subjects, there's a pretty good chance that we also have filarial worms. Absolutely. I'm just going to go to your questions for a few minutes here. Hi, Bonnie. So great to see you. Hello, Rick. Hi, Darren. So there are clean up the poison that's causing MS. The parasites that are there to clean up the poison that's causing MS? No, Darren. The parasites are not cleaning up so the parasites produce all kinds of toxins. They can produce morphine-like substances. They can produce like all kinds of neurotoxins and stuff that affects our cognitive function. So the infections that live in us are the biggest cause of the toxins that we're dealing with, for sure. They do bind metals, absolutely. They do bind metals. So if we're from all of the what they're doing in the sky, the spraying, like that, we're breathing in, and in our environment, we're getting metals. And so yes, if we have metals in our body, in our digestive tract, those parasites will become a heavy metal sink for sure. So they have been researched, they've been finding that they have more metals than we do in them. So that's why we want to definitely, when we're passing them, we want to get them out quickly. But they cause so much more harm. Like It's fine for us to do a heavy metal detox once in a while, but we definitely do not want them living in us. I've done different kinds. You can just literally like look up any worm, ascaris, whipworm, pinworm, and symptoms, and you'll see they cause all kinds of symptoms from the inflammation and the toxins they release. Darren, parasites and bacteria infections are showing themselves to be, if you're poisoned from toxic vaccines, food, air, and my thoughts. No, from what because we've worked with hundreds of students, and what we have found is that there's a history of the antibiotic overuse. And it doesn't have to be very many doses of antibiotics. So the antibiotics, they destroy, they devastate that natural defense that we have in our intestines. The health promoting microbes are really devastated. They're dwindled in numbers. Then there's lots of room for parasites to grow. And we are all exposed to parasites. But if we had a really healthy, thick ecosystem, then the parasites cannot establish themselves as well. But it's when our ecosystem, our natural defense is compromised, then the parasites can really establish themselves in our intestines. And there's lots of food in the intestines. They love to live there, and they move to different parts of the body. So Bonnie, you'd love to hear my take on something that would stop MS. I'm so glad that the research is helping you. So this is like the parasite drugs that treat roundworms are some of the very important recovery treatments that we're using. So when we are treating these parasites, that's when the spasms go away. This is where balance comes back. And we've had people that their drop foot is resolved and their brain fog goes away, their depression, their anxiety goes away, they have strength, they can start working out again. And for people that have been sick for a very long period of time, I can never promise full recovery. But just again, this week, we had one student who's been very, very disabled, and she's getting feeling back in the bottom of her foot. She's able to, like her foot, she couldn't really feel it if it was moved. Now she's feeling it. Now she's moving her wheelchair. Like it's really shocking. One of our, at least a couple of our students had like a clenched hand, like a claw. And when you really start to treat the parasites, decrease the inflammation, all of a sudden they wake up one morning and their hand is open. And of course, it takes time. They have to do rehabilitation to work it again, but they're using their hand again. So the reason that, number one, we want to stop the suffering, we want people to, with their first diagnosis, we want them to be treated for parasites right away. They can just nip it in the bud. They could become symptom-free in 3 months. They can go back to their life and close this chapter of their life and just get on with their life. But for people that have been really, really sick for a long period of time, there is so much more recovery that we can have than we ever thought possible. That is what we have seen with the wellness champions, the ones that are treating. And I've got lots of case studies on our website, Live Disease Free, on YouTube. So you can just listen to their stories and take a Kleenex because it's so beautiful, not sad, but happy cries. But honestly, that is the answer. And the sooner we get our healthcare system on board with it, the better. And of course, there is a lot of resistance to this. So that's why it's going to take a grassroots effort from the general public to demand different. How do animals get treated? Bonnie's wondering, same way as us. So they test really, so there's some common dog dewormers that are like, I know one blend is parental pomawade and praziquantel. Again, it depends on what parasites your dog has. And fenbendazole is another one that a lot of animals are using. I'm trying to think what else. For sure, fenbendazole and praziquantel and parental pomawade. Those would be 3 that I know are used quite often with dogs. Ivermectin, I'm not sure with dogs, but I know for sure with horses. Hi, Kim. Your great feelings, awesome. And then David, you're just wondering, the live disease-free treats for fungus, and if possible, that the CSF has, yeah, so any parasites in the central nervous system. So like we understand that when we have chronic disease, we have dysbiosis. So we know we have different types of worms, and we're not even trying to figure out which ones they are because the tests are poor and there's literally hundreds of different worms that can cause symptoms. So, and cause disease in humans. And the same thing with bacteria, the same thing with protists. But there are some important treatments that, like 2 or 3, that will treat roundworms. And so do you test well for that? And so if you do, then you probably have roundworms. Do you test well for certain antimicrobials that will knock back fungus or knock back other small bacteria? Do you test well for certain parasite drugs that treat protists? So this is what we do. And it's really important that we're covering like the roundworms, the protists, the flatworms, whatever we test well for, fungi, bacteria. We really don't worry that much about viruses because what we have found is when you treat all the bigger parasites, viruses are not living and they just seem to kind of go dormant again if they're even active. There's so much. I did a video on EBV, Epstein-Barr virus. The research is very, very weak. So I'll help you to go through the study of what they're trying to say. Oh yes, MS is, probably caused by EBV. And it's like, well, if that's the case, then why is it that most of the population tests, like up to 96% of the general population tests positive for EBV? Then wouldn't a lot more people have MS if almost everyone has EBV if they're positive? So it's very weak. And it's more like a distraction, I think, for us because they would like to create a vaccine to treat EBV. Awesome. Yes. So 10 out of 10 is a strong argument. You're absolutely right, Rick. And why are the researchers not doing larger studies? That's what we want. But literally, I think what will happen is we're going to have to create a society like the MS Society, but our society will not be held hostage to any particular pharmaceutical company. It's going to be like, does this research look promising? And let's put our money towards that research. And so this is what we need to do. Will the results of the diet and treatment show on an MRI scan? Taylor, the lesions in the central nervous system are pockets of parasites. It's inflammation from your immune system fighting some type of parasite. That's what a lesion is. I've done a video on all of this. There's tons of research showing that many different parasites cause lesions in the central nervous system. So I don't think that you can starve the parasites to death with diet because our body will always maintain a specific glucose level, blood sugar level, to keep us alive. And the parasites will still benefit from that. So they're not going to be just as active and producing as much poisons, but they still will be alive. And they definitely will be more quiet, and we do see symptom improvement. The only way to recover is to treat them. Taylor, there is no diet that will cure parasites. All right, it's helpful so that we tolerate the treatments better, we can treat faster, but there is no diet. Ours, Dr. Terry Walls, there is no diet because you literally would have to stop eating. And then if you do stop eating, your body's going to break down muscle into sugar. So you're still going to have sugar in your blood. You can't starve them to death in your body. Unfortunately, you have to treat them. So Jackie, you're just wondering about DEC. Could that be in the treatment rotations? A person could be energy tested for that. Absolutely. And then Angelica, where does one with MS start today? So if this is really new to you and you're like, well, Pam, this sounds interesting, but I'm pretty skeptical, then just watch videos. I've got tons of videos, learn about the parasites. Probably your best bet is to go to our website, livediseasefree.com, and I have great blog posts so you can listen to the shortened video or you can just read, and there's links if you want to do some more digging on very important topics where I'm sharing like a case study of one of our students right now in the program. I shared a bunch of roundworms, the fluke, so you can see what the students are passing. And then I also have a lot of, to start changing your diet for sure. So follow the Live Disease Free guidelines and get the carbs down really low. You'll notice some significant symptom improvements in as little as 1 to 2 weeks if your carbs are low enough. And then when you're at the place where you've done your due diligence, you're like, Pam, I know I have parasites. I just, everything you say makes 100% sense, but I don't have a practitioner to help me. I don't know what to do. I don't want to mess around. I need to get my life back. I can help you in the Live Disease Free plan. So then you would just watch the masterclass training. I have a free masterclass training. It goes over all the steps you're going to take to recover, lots of case studies of people that have been on the journey. And then if you're like, yes, this is what I want, then you'll be able to fill out a form and you can book a time with me and then you can get started. We've had, I think, 4 students join last week, and I think we have at least 3 that have joined already this week. And people are joining from all over the world, and you don't have to have MS to be part of this plan, because parasites cause all autoimmune disease and they also cause cancer. All of these, so there is no such thing as autoimmune. Your immune system is just not attacking your body for no reason. It is your immune system is overwhelmed with infection. It needs help. So don't suppress your immune system. Please start to learn about how you can support your immune system and how you can treat the parasites that are causing all of this inflammation in your body. So watch the masterclass training, fill out the form. You're going to get an email from us that says to watch the coachathon before we meet. And so go through that because you'll really understand the plan well. And then when you and I meet, it'll just be like, I want to go over your health history. I want to get to know what things you've done, what you were diagnosed with, what you've tried, where you're at. You can ask questions about the plan, and from there, you can join. Or some people just join and then they talk to me after. But if you're working with me, you and I are going to chat. I want to make that personal connection with you because we're going to work, and I am going to, and I'll do this next week, but we have some amazing, amazing students that have been in the program for about 3 months now, and miraculous changes in their quality of life, like crazy. They're not done treating, but they're so far along, and they've done that in just 3 months, or maybe, 3 months, because they're still in the plan. So last couple of questions here. You're so very welcome. I'm so grateful that you found this helpful. I'm going to let you guys go. We've been on for a while. So there is hope for you. You do not have to live with this. You do not have to live with this parasitic infestation, but you have to choose to take a different path. And I did that when I was just 28 years old. I was told there was no hope for me. I was told that I would be completely disabled in time. I had a young husband. I had 2 small kids. And by the grace of God, God showed me that it was infection. And that started my journey. And I didn't know what I was doing. But by His grace, now we're pretty much close to 10 years. We're going to have a 10-year celebration. We've helped hundreds of students all over the world in over 15 countries, and we've learned so much, and we want this to go mainstream. We want the doctors to take this over, and that is my goal. So, but you can't wait that long, right? If you are sick, you want to get better now. So make sure to become informed, learn, and if you need support, reach out. We're supporting students all over the world get access to treatments and the care that they need. So take care. Bye-bye for now.